Good morning. How are you today? Let me hope just fine. If not, that's fine. You're going to make it fine because you're going to think of something positive. You're going to be thinking of blessings you have received in spite of. So if you start counting the blessings, they're going to outdo the negative things. So let's be positive today. I'm Dr. Miriam Smith. I'm the host for Empowering New Nurses. Now, the book that I have written, authored recently is Nurse, the guide to empower new nurses in the delivery of high quality care to all patients. That's the guide. Yes, it was born because of my passion for imparting knowledge I have and have gained over many years, more than 4 decades. Yes, there's so many changes I can relate to, but there are some tidbits that you will see in this book that might not be recorded other places. They're individual, some are personal, some are shared from other experiences, but they all put together help me along the way, help others along the way. And so I have thought of putting a lot of these information together so that I can share with you, we share with the world. There are many nurses out there who are uncomfortable. And sometimes they are scared to ask some questions, yeah, to those nearby. And so this is not replacing the questions or the answers. However, this can add and enhance your nursing journey. I'm Dr. Miriam Smith, the host for Empowering New Nurses in the delivery of high quality care. I have experience in different areas of nursing. I've worn different caps at different times. And now I've come to this part where I have seen where nurses, there are many gaps in young nurses. And I know for sure, and I've experienced it, where information I've imparted have helped many young nurses. And so with all of those put together, this book is here for you and for others. And the information you have here, it's not just for nurses, although my audience are nurses, my target audience. However, information in here, and if you go on my YouTube at Miriam Amanda Smith, you will see that individuals have given testimonials from reading this book who are not nurses, who it has helped. So let me hope that you will get your copy soon. It's on Amazon, in the Kindle and also on paperback. So you can get your copy for yourself, whether you're a nurse or not, whether you are a young nurse, whether you are a director, wherever area or level you might have been, you can read and we all can learn from each other. And of course, there are little areas where you can put your notes or you can share, or you have staff meeting, you can share and you can interact and see where this can enhance the care that the patient receives. So I am going to read for you from my book on page 54, and you can check that when you get your copy, Self-Advocacy. Because so often, you know that we have not nursing shortage for a long, long time. And changes have occurred, and change is constant in the world today, not just in other areas, but also in the healthcare industry. And so sometimes we, or the nurses, don't advocate for themselves, but they advocate for the patients. And that shouldn't be okay. I'm saying here that hospital staffs are frequently overworked and exhausted today due to the prolonged shortage of healthcare personnel and the challenging situations with which they have to deal with on a daily basis. They have to manage care for diverse groups of patients with various disease conditions, as well as both psychological issues and the idiosyncrasies that need the intervention of peers, managers, supervisors, or other members of the interprofessional team at various levels. So there are times when you, as the nurse or the young nurse, just seem overwhelmed, but not saying it to those in charge of you. And so I'm encouraging you today that remind you that you have a voice. And of course, respectfully, you should let it be known. All right? Don't take for granted when somebody try to help you in a way, maybe in an emergency, that it is being bullied or anything like that. No, that's not what I mean. I'm just saying there are situations sometimes that you are going under, and I would say that the managers or the leadership might not be aware of, and you should let it be known. I remember there was a time when I was at this facility, and we had different projects to do, different projects to do, different projects to do, and the projects were just like overwhelming. It was like do, 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 do. And yes, that was important. However, more staff so would be needed, or more hands or more brains or whatever. It was just like overwhelming. And I was at that point where I was full, and I just had to say it. So I went to my supervisor. I think my supervisor was shocked because I'm not the type of person who usually, but I sense that. And if that's not done, then that could be dangerous for me and dangerous for the patients, or dangerous for my group. So I had to go and say something, and action was taken. So I just want to let you know that there are times you might be not looking ahead as you should. And of course, respectfully go and have a voice, say what you have to say, and respectfully and show, give credit to where credit is due, but where it's affecting you in a way that you won't be able to perform to your best, you should let it be known. And of course, reasonably, fairly, that can be considered and addressed, and the right action can be taken. It was taken, it was acknowledged, and the outcome was positive. So I just want to let you know to advocate for yourselves as you advocate for the patients, because you are human also. I'm Dr. Miriam Smith, the host for Empowering New Nurses. And in this book are tidbits that can help you along your nursing journey. So you can connect with me. There are topics that you would like to discuss. Yes, on YouTube at Miriam Amanda Smith, of course, and Instagram. You can also connect. We can connect. Me a DM, and have a great day. Be blessed.